Okay, well, let us begin. Thank you so much for joining us for NAMI Maryland's 40th annual conference. My name is Mike Bettis, and I'm a volunteer with NAMI Maryland. I will be your moderator for this session today, and the name of the session is Building a Mental Health Network of Support, Informed Services for Uninsured Latinos, presented by Monica Guerrero Vasquez, Marcena Maxim, and Sarah Polk from Johns Hopkins Centro Sol. You can read more about our amazing presenters, including their full bios, in the digital conference program on the official conference website or your app. The Mental Health Symposium that occurred in May 2022 presented a very innovative strategy to address mental health needs of Latinos in Baltimore. And this workshop will navigate through the lessons learned and also the science behind culturally appropriate services for Latinos, while working together to address their mental health care needs. If this is not the workshop you meant to attend, please click the back button on your browser or click the sessions button on the left-hand side of your screen to return to the full list of workshops we have available, and then you can choose a workshop that you would like to attend. We will be addressing questions at the end of the presentations. If you have any questions as the presentation continues, please post them to the Q&A on the right-hand side of your screen. We will be reviewing questions as they come in, and if something in particular is unclear or needs to be expanded, we will ask our presenters after their presentation has concluded. We are also pleased to offer closed captioning for this year's conference. Captioning is only available for attendees using a desktop. To enable captioning, please click on the CC icon below the display of our presenters at the bottom of your screen. And once you click the icon, the video displays will become smaller and you will see the captions begin generating underneath. If you have any comments, concerns, or technical issues, please post them to our chat and our technical assistant will address them accordingly. I'd like to now welcome our presenters for today's workshop, Monica Guerrero Vasquez, Marcena Maxim, and Sarah Polk. Thank you so very much for joining us today.
Good morning, Mike. Good morning, everyone. Thank you so much for joining us in this workshop. And please don't leave. Don't click the button to go back. I'm going to share my slides, so give me a second. I'm going to ask my colleagues to just open the mic if you don't see the slides. My name is Monica Guerrero Vasquez, and I am the Executive Director of Centro Sol. And I'm honored to be today presenting with Dr. Sarah Polk, who is a principal investigator in this project. She's also co-director of Centro Sol and an associate professor of pediatrics at Johns Hopkins School of Medicine. And Marcena Maxim, who's our senior research program coordinator for research in this project. For our session, we would like you to get some lessons and ideas from the work that we have done to describe depression as a public health problem that impacts immigrants, to assess the mental health needs of uninsured Latinos in non-clinical settings using a culturally appropriate approach, and to identify available resources for the uninsured Latinos with depression that can meet their needs. I would like to pass the mic to Dr. Sarah Polk, who will help us navigate through the background of the work that we have been doing.
Mental health affects Latinos just as it does all other communities in the U.S. In a report from SAMHSA in 2022, it was found that 18% of the Latino population reported a mental health condition, and among those, 1 in 4 had a serious mental illness. From the CDC in 2021, there was a report that 40% of Latinos experienced depressive symptoms compared to 25% of their white counterparts, which may be a reflection of particular stressors experienced by the Latino community, especially Latinos who have immigrated to the U.S. from other countries. Disparities in access to mental health care have a disproportionate impact on Latinos, and those disparities include language barriers, a lack of insurance, a lack of culturally appropriate service availability, And all of these things reduce access to mental health care. And then if we consider adolescents, 40% of Latino adolescents in some reports have reported experiencing persistent feelings of sadness or hopelessness. And more than anything with this slide, we would like to highlight the many levels of stressors that are experienced by immigrants who are Latino and in recent years have come particularly from the Northern Triangle, although you will know from recent news that there's a particular influx at this moment from Venezuela and Nicaragua. So factors that impact or increase the risk of depression are pre-migration, migration, and post-migration stressors. Pre-migration, that would include trauma that's occurred in someone's country of origin, and potentially a sense of failure that there's the necessity to migrate. During migration, migration itself is dangerous, and there's both experienced and witnessed trauma. And then post-arrival, there are all the stressors associated with becoming accustomed to a totally new place of living. And then often, unfortunately, immigration status is highly associated with poverty, which comes with additional set of stressors. So some data from Baltimore about the experience of depression. So mood and anxiety disorders are the leading mental health problem for adult Latino immigrants in Baltimore, according to clinical data from a Johns Hopkins charity care program. And in the survey administered to Latino parents with limited English proficiency, there were very high rates of positive screenings for depression and anxiety disorders. And in the pediatric practice where I work, in a survey of postpartum women, 1 in 3 women had at least mild depressive symptoms. And all of these are concerning both for the direct impact on the person experiencing these symptoms and also on their family members. And so in 2019, we applied for and were funded by the Leonard and Helen Stallman Foundation to carry out a project entitled Addressing Mental Health Challenges Through Community Engagement, a multi-level approach to depression among Latino immigrants in Baltimore. And this project had 2 aims. The first was to promote mental health literacy, specifically to reduce stigma and raise awareness by creating a culturally tailored public awareness campaign. And the second aim was to pilot evidence-based interventions, specifically to create and evaluate sustainable practices based on proven ways to prevent and treat depression. And now I will pass over to Marcena.
Thank you. So to accomplish our goals or aims, we work with Latino Mental Health Network, and that consists of 4 subcommittees. A health service delivery subcommittee. This group had 12 professionals in mental health, primary care, chronically ill care, substance abuse, as well as school-based counselors and advocacy organizations. So we also work with patient engagement subcommittee. This group consisted of 12 limited English proficient Latino immigrant patients or family members. They shared their experience in dealing with depression and the challenges of accessing resources. The other group was Community Engagement Subcommittee. This group had 12 representatives from organizations serving Baltimore's Latino immigrant community. We also had Evaluation and Dissemination Subcommittee. This group had 6 experts in healthcare program design, implementation, evaluation, sustainability, policy, and advocacy. The subcommittees met regularly, patients on a monthly basis, and community and health services on a quarterly basis. And I would ask for the second slide, because here we can see some of the preliminary topics that came up in our conversation. So Latino community faces unique systematic barriers in society that may impede access to mental health services, resulting in reduced help-seeking behavior. Such barriers include, like we have in the area of health services, lack of Spanish-speaking mental health care providers, lack of health insurance. Undocumented immigrants are rarely eligible, and they face many barriers to a few things that they are eligible for. So there is need for other services such as transportation, housing, finances. Also, the lack of legal status and the discrimination that comes with it can also negatively impact mental health. So being undocumented can cause fear and anxiety due to limited resources, marginalization, isolation, stigmatization, and exploitation. Um, Lastly, religious values, acculturation, and beliefs about mental illness and treatment have also been deemed barriers to mental health care. So mental illness is often stigmatized in this community, resulting in prolonged suffering in silence. Many believe that, for example, their family won't support their treatment, their family or their friends. So how we work with those subcommittees? For example, we wanted to understand the perception of mental health and depression in the community. So using photo voice, a participatory action research method, we invited Latino community members to take photographs representing their perspective of depression. So participants discussed the meaning of the photos and they proposed actions to address the problems they identified. One of the participants said, like, we express our voice through these images because if we don't express ourselves, no one will guess, no one will know. So they said we need to knock on doors. In the discussions, participants addressed questions: what is depression? What people from my community say about depression? Where do we look for resources and why? What are the main obstacles in accessing them? So the process of taking pictures and telling stories helped participants to reflect on their personal and community experience. It helped create a critical dialogue and share knowledge about community coping strategies.
So we were working interactively with the subcommittees, as Marcena mentioned, in monthly and quarterly meetings with the different subcommittees. And we were trying to organize their thoughts, ideas, and comments. And so we pulled the social ecological framework that maybe some of you are familiar with, because that helps. It's a complex model that shows the interactions between different levels, the interplay between individual, relationship, community, and societal factors that may impact the health outcomes of our communities. We discussed barriers and facilitators to address mental health care needs of the Latinos in Baltimore. If you can read the slide, it's not necessarily very friendly, but at the individual level, they were talking about innovation and how we can have in-person and virtual programming of all sorts. Creative arts can be welcoming to people and allow collaboration and are less threatening or intimidating to traditional talk therapy. And that links very strongly with the societal reflection that they made and policies that may need to be changed. For example, they said case management and clinical work, you can't separate one type of work from the other. Before you can talk about their feeling, you have to listen to their problems that they have, ask about their knowledge of health clinics, maybe even during the session. I will be calling them. You can't treat the client in isolation of the system they live in. And we found that was very, very powerful, and especially the interconnection at all levels. So to condense and really, it's the next one, to condense and really amplify the work of the subcommittees in the Latino Mental Health Network. We convened a symposium that was a space for sharing and conversation among different organizations and clinical professionals, mental health professionals. The symposium took place the same week of the mental health conference that we host. That was more academic. During the symposium, we share lessons learned and promote equitable approaches to serve Latinos. We offered continuing medical education credits, and something that was a highlight for us was that we were expecting more clinical audience. However, we have over 200 registrants, and only 26% of them were clinicians. There were many other non-health organizations that included youth serving organizations, social services, and other community-based organizations that were interested in the mental health linkage and the mental health problems of our Latino community. During the symposium, we did a lot of discussion and interaction. So I'm going to dig deep a little in this poster that you see on your screen that just breaks down how all the conversations that we had with the subcommittees, the patients, the community, the health service organizations came up again just to solidify the discussions during the symposium. So give me a second because I have to share the screen again. On your screen, you should see the slide that I was showing earlier that shows the network that we were trying to build at the symposium. And Marcena will help us navigate through this piece.
Mm-hmm. So we ask like the same questions: what are the obstacles and what are facilitators to receive help? So when we ask about the obstacles to receiving help, participants of the symposium mentioned stigma, denial, also English-only providers, and distrust in doctors and healthcare system. They also mentioned toxic stress in Latino community, in patients. They also said that depression immobilizes, so it's hard to seek for help. One of the obstacles is affordability of care, also pre-immigration trauma, funding instability, religious belief, lack of computer or web access, and also transportation access. So we can say like they repeat what we already heard in the subcommittees meetings, and they added more observation during the symposium. For the question, what are the facilitators to receiving help? They mentioned community and social media groups, online session, also transportation vouchers could be helpful, information and school resources, also to create services based on community needs. It's very important. Monica, can you take this?
Yes. So when something that we were trying to do at the symposium was get everybody to see who was in the room and how they could get connected, and also reflect on what they are going to do from the lessons that they were getting during these conversations. Because one of the focus was to practice the language of care or compassionate communication with them. So they mentioned that they will connect to patient resources, provide training to non-immigrants on the immigrant experience, provide time and space for healing, and also provide culturally humble and trauma-focused interventions. That was a big highlight for many of the providers in the room. All of this was a reflection of building trust through compassionate communication with in clinical and non-clinical settings similarly. So some of the things that they mentioned in the symposium was that during COVID, everything shut down, but the needs of people did not. And that was really strong for everybody to hear in the room. They also found that it was important to create connections for patient success. So not just giving a phone number, that we will mention that again later, that we need together to advocate to address resource limitations. We have to increase our own level of self-awareness. Where am I? What are my own biases? Where do I stand in the stigma around healthcare and mental health care for the clients that we serve? It was very important to provide individualized and culturally sensitive care. So being bilingual doesn't necessarily make you culturally competent. However, it can support a lot the care of an individual. The support for community belonging spaces, people that feel that they can fit, having groups where they can have similar conversations is very important while they build their connection with the mainstream programs. And another thing that they highlighted was build trust through community connections. So again, being able to connect people to resources and friends. And in general, just to centralize and focus a lot of this discussion of compassionate communication around mental health was to acknowledge that there is stigma, and what are we going to do and what tools we're going to use to address that. Identify the problems apart from depression. So think about social determinants of health that may be impacted by barriers that they face. And very important that we will also highlight later is to listen to stories and understand the context of these individuals. They all agree in the session that the stories can be very powerful to understand the mental health needs of these individuals and why they are getting to where they are and why they need the help that they need. So again, one of the highlights of the symposium was the reflection about how we can talk to our clients or patients about mental health. How can we identify the needs? We reflected on the understanding and science around cultural competency. How cultural competent am I? How does compassionate care or compassionate language impact mental health? Our colleague Jessica Contreras, who's a clinical social worker, shared important takeaways for clinicians and non-clinicians. Something to take from that was the new arrivals happen often. We have new arrivals often have low literacy rates, and now everything is online. Again, as I mentioned earlier, being bilingual does not make someone culturally competent. We have to think that victims and survivors are not always aware or ready to ask or receive help. And that for that reason, we have to meet the patient or the client where they are. And very important was to practice kindness, that people remember how you made them feel.
So participants of the symposium also shared that most of their clients are resilient, and with some support they can get through situations. Community belonging has a strong ties with the individual's mental health. What is very important are support groups with similar cultural ties and language. And also one of the tips was to expanding that support to the mainstream facilities, connections in the community, increasing social support such as church membership, support groups, exercise gyms, running groups, meditation, yoga, school English classes, community colleges, also many community organizations. They mentioned the importance of friendship with when it's poor support from the family. So how important is the support of the friendship? During the symposium, participants shared best practices to work with Latino immigrant community. And so let's navigate through some of the lessons learned and from practice used by therapists, but we can all practice this. So one of the tips was practice reflective listening, commonly used among therapists and clinical social workers. This method facilitates the communication and understanding of the interaction. So one of the examples is mirror what people are saying or paraphrase what you hear. For example, I hear you are saying that, it sounds like you feel, you're telling me that.
It is also very important to remember that primary care could be a great entry point for mental health care. Using the local federally qualified health centers or community centers could definitely be a connection when people feel that there is a need, or they could be even ready or get ready to receive mental health care. On this screen, we just share some of the programs that we have here in Baltimore City, but I'm very confident that we will be able to identify more later on with you all. Something to remember when we do this referral in connection to primary care or other services is that we need to help people navigate the system. Something that we wish you all to remember from this workshop is that just providing a phone number is not enough. Help your client to get connected and follow up. If you just give them phone number, the next time you see them, ask them, did you call? Did you make the call? Did you receive the help that you needed, that you were looking for? How was it? And it can take 5 minutes to really understand what their experience was. Take time to reflect and model for clients strategies to learn new things. Immigrants come into a new space, a new culture, and they may feel disconnected completely from the services and resources that we know of. So think about how you can provide support for that. Also time to make connections and build your own networks to support the clients. Do you know some organizations that have been helpful? Do you know people in organizations that can help you connect your clients with the services that they provide? There are in Baltimore City a lot of resources, new resources that are coming up for financial assistance that people are struggling after COVID a lot. So do you know what those programs are? Are you familiar with where you can refer people to get assistance? And again, primary care providers use diagnosing tools like PHQ-9, and some of those are available. Mental Health America has a platform, a website where you can check your PHQ-9. So talk to your clients about those resources if they are ready to talk about their mental health. So in short, as I mentioned a couple of times already, meet your client where they are. What works for you may or may not work for your client. So try to walk in their shoes. Take time to listen to them. Their stories can be very powerful. Ask about how they feel, what they are experiencing. Encourage the use of a diary if they know how to read and write, or exercise in many of the community activities that are around or by themselves. Advocate for them and with them. As I said earlier, when you refer them to services, just make sure to check with them and see if they were able to get access to those services. Also find hobbies or use apps that they can install on their phones and work, for example, for exercises or connecting to services. Important for the clinicians in the room is to support medication management and therapy. It depends on where your client is in their mental health journey and healing journey. Are they ready for therapy? And if at some point they get medication, especially for mental health, just check with them to make sure that they are following the prescription. Something that happens when you migrate to a new place is just to get to work and go back home. And there is a lot of distrust that are supported by policies and things like that. So encourage friendships and connections that are going to help them be part of the community they are in, and try new things, new routines that can be helpful for them to connect with the new neighbors. So after this symposium and through this 2-year project, 2+, because we have to make a lot of adaptations during COVID, we were able again to go back to the social ecological framework to make this complex interconnection between individual, interpersonal, institutional, community, and policies, to propose you all and policymakers in the room an action plan to share some of the lessons learned and some implementation that we can do and practices that we can have in our communities. And I'll pass the mic to Dr. Polk to navigate us through the different challenges and solutions that we identified in all these conversations with patients, community, and health services.
So we'll leave you with about 4 general action steps. So the first is ongoing support for free community-based programs aimed at all aspects of mental health, from mental health illness prevention, increasing mental health literacy, reducing stigma, building community and social capital, which can be a form of mental health illness prevention, and addressing mental health in many of the venues serving Latino immigrant communities. So not limiting discussions of mental health to healthcare, but bringing them into churches, libraries, salons, and schools. The second action point is to look for opportunities to invest in a culturally responsive mental health care workforce. This can be done in a number of ways. This can be done by strengthening the role of promotoras, who have proven to be a very valuable part of the workforce, by establishing public and private funding for promotoras. And there are many other aspects to the promotora position that require attention. They right now are often written in a very limited role, and we need to consider: are they getting paid a working wage? Are we making reasonable demands on them? Are we providing them with adequate training and supervision? And if they wish to remain in these roles, what is a pathway for promotion that recognizes their skills in settings in which they're new? They don't really fit into existing HR hierarchies, and we need to create those pathways for them. And the second 2 action points are, number 3 would be that investing in communities may have important mental health benefits. So it's that bringing mental health into all spaces, and then when we invest in other activities, there may be secondary benefits to people's mental health. So there's the notion that's been around for a while now of healthcare in all policies, or health in all policies, and we would like to see that expanded to mental health in all policies, meaning that what are the mental health implications of addressing violent crime, of changing policing policy, of building a new park, of expanding a school, and sort of really there may be ways to advocate when the topic at hand or the investment at hand really seems at first to have nothing to do with mental health, and that the program evaluation should consider looking for ways to evaluate the impact on mental health in any kind of large-scale project. And then finally, really the most important is to advocate for healthcare for all. Insurance and access to a doctor would not solve all the issues that we have discussed, but it is a critical issue of equity and needs to be on the table. So all the other things that have discussed are really more in the category of a Band-Aid, and this is a policy that could allow us to really move forward in a much more meaningful way.
So at this point, we would like to get you participate. You see 2 QR codes on screen. that have resources that we compiled. The first one is the educational website in Spanish called Fortalece tu Bienestar. It's an evidence-based platform that was developed with our Latino Mental Health Network to provide culturally appropriate information, again in Spanish, based on stories. The Fortalece tu Bienestar, Fortalece means Fortalece tu Bienestar means strengthening your well-being. We thought about different names like depression, learn about depression, think about mental health. But the Latino Mental Health Network informed us that due to the stigma and the misinformation and the lack of resources and everything that we mentioned today, that was not going to be appealing, just having the name of this campaign be or include mental health. And we explored with them the different titles and names of the campaign, and they came up with Fortalece tu Bienestar. So I invite you all to check that out now before we leave, because we're going to ask you what you think about that. And the second that is also available in fortalecebaltimore.org is the compendium of local and not so local resources. We have been trying to get more resources available. It's on our website. You can either type that link or go to our website and find Recursos Comunitarios, or you can just scan the QR code and find the resources that we have available there. So we're going to give you a couple of minutes to check those websites. I'm going to ask my colleague Marcena to see if she can put both links in the chat to make sure that people can click there if they cannot access the QR codes.
Just a second.
So before you leave, we would like to all to check those links. And then there will be a small poll that we will open up for you all to fill out. So I'm going to put the timer for really 60 seconds. And Marcena just posted in the chat, fortalecebaltimore.org. Thank you. And now she's going to post the link to the resources. Thank you, Marcena. So you have about 45 seconds to navigate both websites. You can add questions in the chat or also in the Q&A section, and we will respond to them after the 45 seconds I'm just giving you. So we have 10 more seconds. If you can scroll up and down on the resources page. Okay, you will see on your section a poll that I'm going to activate right now, because we would like to hear from you. How many of these resources are you familiar with? And I know it was only 30 seconds to check that website, so no pressure. If you can just click on the poll, and I'm not sure. I'm going to stop sharing for a second, because maybe The poll will come, the results will come later. If you...
Monica, we have a question from Regina about the program. She asked, the Fortaleza tu Bienestar videos are fantastic. How do you use them, and what does your outreach campaign consist of?
Yeah, thank you very much, Regina. We appreciate your question. We use them in different ways. The videos are stories of local leaders, community leaders. First we use them on the website, and Marcena has been leading our social media campaign. So I'm gonna let her answer the social media outreach that we have done.
Yes, we share them on the Facebook page, Centro Sol Facebook page, also on Instagram. So the best reach we have on Facebook page, they are like very short video. Like the version that you see on the website is a little bit longer. We realized when we launched the campaign that the videos has to be very, very short, like 15 seconds even. And then we put the link to the longer video. Videos are also on YouTube. So we are still like, I would say we launched the campaign, but we are still changing a little bit according to the data that we receive from the viewers, and we are constantly asking about the feedback.
And as a general pediatrician, I care mostly for Latino children and immigrant families, and I sometimes include the website in information I give to families. If there's a concern for mental health in the young person, but there's seems to be confusion about what depression is, or skepticism, or if the parent says, well, I understand what you're talking about and I agree, but somebody else in my family thinks that, you know, depression isn't real. So I use it as an educational tool. The website primarily focuses on adults, but it handles the topic generally, which I find very helpful.
Yes, thank you. It was definitely a very interesting experience to build that website and collaborate with the local individuals. You will see a teenager, a clinician who is sharing her story on mental health, and we also have clinicians who are sharing advice on and educational information on our website. So I really invite you all to check that out and share among your clients. And please reach out for the individuals who have responded to the poll. I see that you know all of their resources, so I'm very happy. You can also contact us if you have any recommendations. So before we go, I just would like to briefly mention some things that we mentioned throughout the session today, just as a wrap up. Important cultural awareness supports a community of belonging, so people to feel that they fit and they are part of a community. And speaking Spanish doesn't make you culturally competent necessarily, so we always have to assess that. Compassion is a safe place to meet the client where they are. Help clients to navigate the system, don't just give phone numbers. We know that stigma is a barrier that influences help-seeking behavior, but it's not the only barrier. So listen to the stories of your clients. When you can, if you can, at your institutions, or if you can advocate for those who lack access to mental health care. As we mentioned, we hope we can get mental health for all, healthcare for all through policies, but we definitely need local and individual advocacy. And this space, build a multidisciplinary space to share practices, has a lot of potential to address mental illness among Latinos. We have a list of recommended readings and websites that I hope you will be able to check, because it will give you a lot of information for your work and advocacy. We don't want to end today without acknowledging, of course, our funder, the Stallman Foundation, and the members of the Latino Mental Health Network who were working in person and then through Zoom meetings for more than 2 years supporting the development of this project. So we are very grateful for their support. If you want to reach out to us, Dr. Sarah Polk is the principal investigator, an amazing leader. We're very happy to work with her. Marcena Maxim is the most creative person I know, and I am just helping everybody. You can follow us on our social media. We are on Facebook, on Twitter, on Instagram. We're also on LinkedIn. I'm trying to get another new platform for young people because they say that they don't check Facebook and they are leaving Instagram little by little. So we are grateful with the NAMI annual conference for the opportunity to share this work and bring up some more information about the work with and to serve the Latino community. Thank you all very much for joining. And if you have questions, please feel free to add them in the chat, or you can also contact us.
Yes, thank you so very much for such a great presentation. We would now like to open up the presentation, the workshop, to your questions. So if you have any questions, please post them in the Q&A, which is to the right hand of your screen. If you don't have time to ask questions today, please send your questions and the name of the session you attended, which is this one here, to connection@namimaryland.org, connection@namimaryland.org, or submit your question in your end of event evaluation later this afternoon. And I already see one question that was placed in the chat. Ed asked the question, is the information in the resources only available in Spanish?
That is a great question. The information in the resources is not only available in Spanish, so we are trying to find the language appropriate services for Latinos. The website, that platform is meant to be used by the community. So those are resources that people who are looking for a therapist or a clinic or information can look. So that website is available in Spanish. But the resources don't necessarily have to be in Spanish. What we do a little assessing of the resource. We make a phone call and we do a questionnaire. We ask them how they provide resources. Do they have interpreters? Do they take new patients? Do they see patients who don't have insurance? So depending on what answers they give us, that's what we add on the website. If the resource is not available for uninsured individuals or don't have any resources, any support for language interpretation, sometimes we don't include them because then it creates a burden on the patient if we're referring them to resources they cannot access. Again, we try to meet the client where they are.
Thank you. Thank you so much. Fanny says, thank you very much for the presentation. And Regina offers another resource. She says, we have a Latino clinician information and resource distribution list in Montgomery County, open to professionals in the region. And if interested, you can contact her at regina.morales@montgomerycountymd.gov. So thank you for that additional resource, Regina. Does anybody have any questions? Please drop them in the chat and I will let our presenters know.
I see a question from Ed about promotoras. So promotora is Spanish for community health worker. And I have to admit that I don't know the definition of specialized peer support. So a promotora is a community health worker. It is critical that they are able to communicate effectively with the person you're trying to serve. So often selected specifically for communication skills and for cultural competency. They frequently have some shared lived experience with the population being served, but that's not a requirement. The educational background can vary a great deal. We see often so that the job title is used pretty broadly. So community health workers are sometimes people who finish college and they're taking a couple of years off before they become nurses. Sometimes they're people who are well into adulthood who only had the opportunity to finish high school and are transitioning out from working at a fast food restaurant and want to do something that's more in service to community, or want to do something that's more educational. So we have found them to be a critical part of the team, but want to be advocating for an appropriate role in the workforce, and to have their skills recognized with reasonable pay.
Fantastic. Thank you. And Natalia also says thank you very much for the presentation. We have a few more minutes. If anybody has no question, as they say, is too not smart or too small, so please ask. This is your opportunity. You have some wonderful researchers and clinicians here. This is your opportunity to ask a host of questions to them.
I don't know, Mike, if we can ask a question to the audience.
Yes, please. That'd be wonderful.
Yeah, so I would like to see if you can put in the chat if you are a clinician and if you work or serve Latinos, uninsured Latinos. Yeah, we would like to know you, because we cannot see the names of who's in the list. So I would love to see who you are. That is a great question, Kimberly. I think that's a great question. That's what we did at the symposium. We just asked people for names and resources, and we updated the resource list. Marcena can correct me if I'm wrong, but I think we have someone from Montgomery County, the local behavioral health authority, at the symposium, right? I don't remember at the top of my head the list. Yeah.
Yes, we had.
So we had some of your colleagues at the symposium, Regina. Yeah, that's definitely a good avenue, and probably Dr. Bull can mention a little bit of what Pamela is saying. That you're a research-funded clinic, and yeah, we can totally hear that.
Yeah, I mean, there's just so much work to do, and the problem is that funding sort of moves around. So we can do this one day and that one day, and that's what makes the network so important, so that we can share information, ideally when services expand, but also when there are changes to eligibility or availability. Because a lot of programs are fairly small, so that a change in one staff member can make a big difference.
Yeah, thank you all for joining the presentation today. I was just checking the chat. Yeah, Pamela, if you want to share your contact, we will be happy to connect. And really with everybody. So Mike, you can lead us and let us know what's next.
Okay. It looks like everybody is very full and digesting all the great information you provided. And so I will end a little early to give people a little extra break. And I'll close out by saying, thanking everybody for joining us today. And at the end of the conference today, you will receive a link for an evaluation survey. If you would like to acquire CEUs for this workshop, please submit your responses no later than Saturday, October 22nd. So that's next week, Saturday, October 22nd. And the next workshop session will begin at 11:20 a.m. Be sure to take some time to stretch, get some water, take a mental health break, and we will see you at the next workshop. Thank you again for joining us, and we hope you enjoy the rest of the conference.
Thank you, everyone.
Thank you.